These are the life-threatening diseases for which vaccines are mandatory. So those are BCG for tuberculosis, Hep B is for hepatitis B virus, OPV is oral polio virus, DPT is diphtheria, pertussis, and tetanus diseases. HIB is for Haemophilus influenza type B. Rotavirus is for rotavirus, which causes viral diarrheas and all. MMR is measles, mumps, and rubella, out of which only MR is mandatory. MMR comes as a combination vaccine. So these are the things that are really mandatory. If a person, if an individual, any infant who has received all these vaccines, there are more vaccines, but an individual receiving all these vaccines is defined as a fully immunized child. So, in our national immunization schedule, we have a program by the government which is called Program Indradhanush. So, like the name suggests, Indradhanush has 7 mandatory vaccines to be given to any child to avoid all the deadly diseases. These are BCG for tuberculosis, hepatitis B, DPT, Haemophilus influenza type B, and hepatitis B. So these are the seven, and then polio. These are the 7 deadly vaccine preventable diseases. So which are mandatory for every child, especially living in India. And government of India is giving these things for free. And an individual has his own right to go and get it done in a private center as well. So, but government is also giving this for free. So let's talk about these vaccines in detail. So BCG vaccine, which also the full form of BCG is Bacillus camelgeurin. It is named after the uh, people who have invented this. So this vaccine is for tuberculosis. So in India especially, or any developing country as such, so this vaccine is to be given as early as possible after birth. For people who are, for those Indians who are living outside and whose children have born outside, I'm sure they must have not received BCG. I would suggest them to take it as soon as they come to India if their children are less than 5 years. So you can catch up this vaccine within 5 years of age at any point, because taking BCG vaccine will prevent the serious ill effects of tuberculosis that might happen if a person contracts tuberculosis bacilli. So what happens with BCG is a person will have certain amount of immunity against tuberculosis, which will prevent a person of having a serious forms of tuberculosis disease. If you look at the disease pattern on the graph of this disease, which has created chaos, this is, you can consider as the most killing bacteria ever that human has ever seen, because this is a very slow killing bacteria and it has killed so many people over decades of time, that this vaccine has an important role for avoiding that particular thing, which is death due to TB. So I would recommend all the parents, people who were born outside, to cover BCG as early as possible whenever they come back to India. And then next, let's look at hepatitis B. So hepatitis B is a virus which also has a very slow course in the body, which will affect the body over a very long period. And the patient will end up having hepatocellular carcinoma. The patients will, in the end, die due to cancers in the liver. So also this disease, this particular, yeah. So BCG is airborne disease. It can be spread through airborne, through contact, through being close in contact with anyone who has TB. When it comes to hepatitis B transmission is only parenteral. That means that there should be proper blood exchange between the person who is affected and a healthy person to get hepatitis B. So usually it happens sexually, unprotected sex, especially in gays, and not having safe practices when they're following, when they're giving blood transfusions or sampling or any such thing. So, and then hepatitis B virus, there is no particular medicine which will prevent hepatitis. Once the person has contracted hepatitis B, you can never remove the entire virus from the body. So even if you are giving antiviral drugs to the patient, the virus will only remain latent, only to be reignited later in life. Whenever the virus sees an opportunity that the immunity of the person has gone down. So I would recommend every newborn and parent to make sure hepatitis B is given to their child. If the child is born healthy with good weight and not in NICU, so to take hepatitis B as early as possible. And when it comes to adults, every adult, be it at any age, without any comorbidities or any ill effects, the people who are not suffering from immunity disorders, I would recommend, if they have never taken hepatitis B, especially people who are in the medical field, should definitely take hepatitis B 3 doses. Zero dose, that is on day one, whenever they're taking. From that, first 1 month later to the first dose, and then 6 months later to the second dose. So even adults can take this dose. Every parent can take this dose if they have never been given hepatitis B. And let's look at the third vaccine, which is oral polio vaccine. So back in 2015, we have removed, earlier it was a trivalent vaccine, which means that we were giving a vaccine for three types of polio variants. In 2015, after a rigorous survey that India and had the health system, Indian health system has done, finally India has been declared as polio free. But we still have a problem of the virus, especially from our borders, be it Pakistan, be it Bangladesh, be it Nepal, or any other country which we share borders with. Especially these particular countries, Bangladesh, where population is very high, and Pakistan, where the health sector is not so well as it is in India. So we're still getting patients who have virus in their body from these borders. So we are slowly phasing out the vaccine. So in 2015, the trivalent vaccine has been changed to bivalent. So right now we are only vaccinating our kids with a bivalent vaccine. So the purpose of removing and phasing out this vaccine is, this particular polio vaccine has also got a side effect. The thing is, it can cause wild polio infection. So the virus in the attenuated virus in the vaccine has the capability to cause polio also. So that is the reason why we are slowly phasing out oral polio, and slowly we are shifting our entire vaccination schedule to injectable polio vaccine. So the government is making sure that it gives 3 doses of injectable polio vaccine to every child. One dose at 6 weeks, the other one at 14 weeks, the third dose at 18 months of age. So in a private sector, if you're going ahead with a painless vaccine, every vaccine will have injectable polio vaccine included in that particular painless vaccine. So the importance of polio is to avoid any disability in your child, which might happen, especially in the lower limbs. In worst case scenarios, patients might end up having respiratory failure and they'll pass away, they'll die. So thankfully, our rigorous vaccination, and the pulse polio that we do every year in January. So due to this and the awareness that the government has created with advertising and with mass immunization and media usage, all these things have made sure that India is finally polio free. And then yeah, that's about polio. And let's talk about diphtheria, pertussis, and tetanus. So this particular vaccine is very notorious. So this vaccine it's basically comes in a trivalent mode, which covers three particular diseases, which are diphtheria, pertussis, and tetanus. Tetanus is that tetanus bacilli, which will get transmitted through contact or dirty places or dirt or any such thing. And pertussis is Bordetella pertussis is a bacterial infection which will cause prolonged coughs, and the patient might die due to systemic symptoms. And diphtheria causes a pseudo membrane in your throat, a membrane in your throat so thick that it will slowly compress your airway and it will kill you. So these vaccines, these three vaccines are deadly. These three diseases are deadly diseases which might kill you. So due to proper vaccination of this particular DPT, we have not been getting enough cases, not even enough. I would say not even a case per 1 lakh to 10 lakh population since decades, since like 2 to 3 decades. So we haven't been seeing any diphtheria, pertussis, or tetanus cases as such, and it is only due to the vaccines that we are taking efficiently. So, in these three vaccines, the most important vaccine which will cause trouble or problem is the pertussis vaccine. So, there are two variants of pertussis that people usually take. The first variant is whole cell vaccine. So, in this particular vaccine, the entire cell of a bacteria is has been attenuated and added into the vaccine. So, this particular vaccine causes pain, causes fever, causes swelling in the thigh or the vaccine site. So for people who would like to have a painless vaccine, so they have an option called acellular pertussis vaccine. So in which the cell wall and the things that usually create these side effects have been removed. So the only difference between these two vaccines as such is the price that they are sold at. So wholesale vaccine is fairly cheap and the government of India gives it for free. And whereas the ASLR pertussis vaccine is fairly expensive. So when you take an painless vaccine, it comes as a polyvalent vaccine. It'll have DPT in it. It'll have hepatitis B in it. It'll have Haemophilus influenza type B in it, and it'll have injectable polio. It'll have six vaccines together, and it'll cost you around 4,000 per each dose. And a particular patient will receive at least 3 doses in the first year and 1 dose in the second year, 1 dose at the fifth year, and 1 dose at 10th year of age. So there are five amount of doses, and I would always recommend all the patients or my patients to go ahead and get it done in a government setup because they are free for them and the government pays for those vaccines. So that's about DPT, and let's look at Haemophilus influenza type B. So in infancy period, in the first age of period, this particular vaccine causes a lot of problems which are life threatening. So this is the vaccine which might cause meningitis, that is brain infection. This is the virus that might cause deadly pneumonias. This is the vaccine which will have very ill effects if not given timely and if the child gets infected, especially in the first 3 months of age. So for Haemophilus influenza type B virus, so this vaccine given in 3 doses will prevent the disease for lifetime. Same goes with DPT, same goes with hepatitis B. So these are the vaccines which will prevent infections for life if the patient is good enough without any immunity problems or any immunodeficiencies in their body. When it comes to polio too, yeah, when it comes to BCG, tuberculosis, it doesn't prevent infection or disease, but what it does is it prevents the deadly form of a disease. So even in spite of having BCG, if you think that your patient has ended up with tuberculosis, then it is actually normal. The only thing that it will prevent is it is going to prevent the deadliest form of tuberculosis. That's it, which is more than what we expect a patient to have. And let's look at rotavirus. So this particular virus is a very notorious virus which has killed a lot of people in Africa or India when it comes to having poor sanitation. So this is mainly a waterborne disease. It spreads through water, contaminated water, or not having proper sanitation at home or in your area or in your country. So this is a problem in developing countries as such, be it in African continents or in India or Pakistan or Bangladesh or any third world country, to be specific. So this is to be covered within 6 months of age. If this vaccine is given after 6 months, there is not much use for a patient to receive oral dose of a rotavirus vaccine. So if covered within 6 months in 3 doses, which is given at 6, 10, 14, and this is an oral vaccine, this doesn't have side effects as such, which the vaccine might cause. So, if a patient has immunodeficiency, this might cause rotavirus infection and diarrhea. But there haven't been any cases which, due to vaccine, the patients haven't ended up into diarrhea. So I recommend everyone to make sure that they receive rotavirus within 6 months of age. If they have missed any dose, so make sure that there's a 4 weeks gap for dose to dose, and make sure minimum 2 doses have been covered within 6 months. But I would recommend a patient to take 3 doses. And this vaccine also is being given by government of India for free. And the last dose of the last vaccine in mandatory vaccines is MMR, so which stands for measles, mumps, and rubella. Government of India gives measles and rubella for free at 9 months and 15 months. But if you take it in a private setup, it comes in a triple form for measles, mumps, and rubella. So measles, these three are viral diseases. So one is called German measles, one is called rubeola, and the other one is called rubella. So measles is, we can call it as a fever with rash. The thing with measles is it affects your lungs, it affects your immunity. So there are significant amount of cases due to measles which the children after getting infected have lost their lives due to pneumonias which measles has caused. So usually we healthcare professionals, we recommend every patient to receive at least 2 doses of MMR within 2 years of their age. So in developed countries, they have stopped giving measles and rubella since a very long time. But in recent times, United States of America has faced a lot of issues with measles and a lot of deaths due to measles. So countries like US and UK, they have started this MR campaign again. So they are going into the societies, going into the schools, and finding patients who have never been vaccinated with MR, and they are running a campaign of measles and rubella. So this particular vaccine has got so much importance that it is creating chaos even in the developed countries. So make sure whoever are NRIs who have missed a dose of measles and rubella, and if their kids are less than 5 years, they can still take the dose of measles, mumps, and rubella. So these are the mandatory vaccines, at least in India, which every patient should receive as early as possible, mostly within 1 year of their age. And if a patient has received all these vaccines together with the dose of vitamin A, is considered to be a fully immunized child with Indian standards. Yes.
Wow, that's a lot of information, doctor. Even I didn't know the details of every vaccine, and I have a 14-year-old as well who's been
Okay.
fully vaccinated. This was amazing information. Thank you
Thank
so
you.
much. Thank you.
One question,
Yeah, please.
doctor, they have this triple vaccine that you say there's a painless and a pain-free. So can you give some clarity? What is it? Parents always ask me, and I think it'll be good that if you talk about it.
Are you talking about the pain thing?
There are vaccines, one which say the doctor says pain-free, and then there
Yes,
is
yes,
a
yes. So,
pain
yeah, yeah.
regular.
Let me clarify the doubts regarding pain and pain free vaccines. So, technically, there is only one vaccine which causes a lot of pain and fever, that is DPT. So, whenever you are taking a vaccine which has DPT in it, if you really want a painless vaccine, and ask for your healthcare professional that you need a pain free vaccine, and he'll choose a vaccine which has acellular pertussis in it. Otherwise, every other vaccine will only cause pain when it is being pricked. That is all. Later, the patient won't have any feel. So there's only one vaccine in the entire world or a spectrum of vaccines that we have, which is highly notorious right now. That is DPT, which has a whole cell pertussis in it. It causes pain, it causes swelling, it causes significant amount of fever for a couple of days.
So you mean to say there is no difference as such between regular and pain-free? Not much.
Yes, yes. See, technically speaking, wholesale vaccine, if you compare it with a single dose of acellular vaccine, so when you put these two vaccines side by side, so I would definitely say that wholesale vaccine has got great immunogenicity. It causes great lot of immunity if given in a single dose. So here we are at least covering 3 doses in first year. So the number of doses you take from pain-free vaccine, in the end will amount to the same amount of percentage of immunity that a wholesale vaccine will give. So in a long run, on multiple doses, there is not much difference. It is almost same. Only thing is, for a person who is taking pain-free vaccine, he'll have to burn his pocket.
Just to clarify, doctor, are you trying to
Yes.
say that if we opt for the pain-free, what we call pain-free, it
Yes.
basically the doses are going to be broken up for us so that there's less chance of fever, or what is it?
Not at all. Not at all. Not at all.
It's
So
not like
the thing is, the difference between these two vaccines is the vaccine which causes pain has the entire bacterial unit in it. It's a whole cell unit. The entire pertussis bacteria has been incorporated into the vaccine. So for pain-free, what they're doing is they are removing the cell wall of the bacteria. It's called acellular. So whichever unit from the bacteria's body is causing pain and fever is being removed in it. Only
okay.
the nucleus and the main DNA matter which the bacteria has is being given to the patient, which is actually giving immunity but not causing the side effects. So due to this extra process that the companies are doing, so they are charging huge amounts. Technically, so it does cost a lot.
So yeah, but barring the cost, it is that there are lesser immediate side effects. Is that,
Yes,
can you say
yes,
that?
yes, definitely.
Okay. Because asking from a parent point of view, like if my baby is getting it, so then there are
Yes,
lesser on the spot side effects or whatever. I mean, if you can say.
definitely. So I
Okay.
would also see there is definitely a downside to it. So we are giving in within 1 year of age, we are giving 3 doses of DPT containing vaccine. So any pain-free DPT containing vaccine, even the Indian maids or even the cheapest versions of it will cost you around 3,000 per dose. So technically they'll have to spend at least 9,000 even if they have to take the cheapest one in the first 6, 10, and 14 weeks. And the number of the problem that this pain vaccine gives, so it dies down as you keep increasing the number of doses. It might happen a lot in the first dose. It might cause a little discomfort for the second dose. It might not cause anything in the third dose. The body will become resistant to it.
We have a question, but we'll take all the questions in
Yes.
the end, doctor.
Yeah,
So,
yes, yes.
parents, you can put down your questions in the chat box. We'll take it towards the end. Fine. I think let's move on to the next slide.
Yes. Yeah, this is a huge concern for new mothers these days. So weight gain. We see in our clinics regularly that parents keep weighing their child. They, as soon as they have a baby, they make sure that they even buy a new weighing scale at home and keep weighing the baby every now and then. So they keep getting confused if the baby is gaining weight or not. They keep comparing on a daily basis, which is technically not healthy for any parent to do it, because it creates a lot of anxiety, it creates a lot of confusion at home and a lot of doubts in their mind, and in the end they'll stop enjoying the parenthood. They'll have a lot of concerns. So let me just clarify and let me just tell you a few important milestones that you should check instead of checking your baby's weight on a regular basis. So whatever the birth weight of a child is, so the healthy birth weight for Indian child is between 2.5 kilos to 3.5 kilos. Anything below 2.5 is low birth weight. Anything above 3.5 is, I would say, large for gestational age or extra weight. So the healthy weight for any newborn in Indian setup is 2.5 to 3.5 kilo. So let us just say that if the child was born with 2.5 kilo at birth, so the target weight for a child to increase over 6 months of period is the child should become 5 kilos. That is double the amount of what his or her weight at birth was. So at 1 year it should be 3 times. At 4 years it should be at 2 years it should be 4 times. So these are the minimum targets that you should look at. So after 2 years, 2 to 5, the somatic growth will almost plateau. You will feel as if the child is not growing. He's been the same since 2 years. That is what every parent feels. But that is how the normal graph goes. So from age 2 to 5 years, child will definitely gain 1 kilo in a year, but you won't have any visible effects that the child is growing or putting on weight. So these are the initial few things that you should keep in mind, at least for 2 years target. So birth weight into 2 should be 6 months target. Birth weight into 3 should be 1 year target. Birth weight into 4 should be the 2 years target. So what happens with even kids who are exclusively breastfed? So what happens with over enthusiastic mother or anxious mother is they keep feeding their children so often and so frequently that the child will end up having so much extra weight that after 2 to 3 months of their birth, they weigh almost more than double of what is expected at 6 months. So if you at least maintain these targets, this will be healthy. See, even low birth weight is uh, the child not gaining weight is also not healthy. The child gaining a lot of weight is also definitely not healthy. So children who are more than double within 4 months of age or 3 or 5 months of age. So technically, what is happening is the child's metabolism is setting up in such a way the child is ready to accept how much ever is being given to the child. So the metabolism will keep modifying itself so that the in future when the child grows or into adolescent or becomes adult, the child's metabolism has become so much that the child is capable of taking how much ever is being given. So this is basically a stepping stone for obesity. This is where you are modifying your child's DNA and metabolism in such a way that you are opening the gates for obesity here. So this is one thing, and similarly it applies to children not gaining enough weight as well. So for the children who are not gaining enough weight, the metabolism, the DNA will set in such a way that the child's body will be okay even if it receives least amount of reserves. So the body will compensate the extra reserves by killing some amount of cells or by using up all the long term stores that we have. So this is also a problem in future. So we have to keep maintaining these particular targets instead of overfeeding or underfeeding. And the importance of P count is to only emphasize if your child is having enough feed on a daily basis. So when it comes to frequent visits that the parents do to the clinics is they feel that whatever feed the mother has or is the mother feeding to the child, the mother feels that it is not enough for the child. So the importance of P count comes here. So if the child is taking in feeds very well, sleeping very well, and passing pee for more than 4 to 5 times, usually babies pass more than 7 to 8 times in a day. But at least if the baby is passing more than 4 to 5 times in 24 hours period, even if the baby poops or doesn't poop, it doesn't matter. So what matters is the pee count more than 4 to 5 times a day, feeding well, sleeping well, and playing well, and has a good expression on the face all the time. So it just means that your baby is not dehydrated and the baby is getting sufficient feeds. You need not worry. We need not increase the frequency, or you need not increase the quantity of feed. You need not introduce any formula milk or animal milk if a child is already on breast milk. If it is just your feeling that the patient, the baby is not receiving enough feeds. So I would recommend every parent to be confident. And if the baby is crying too frequently, I would recommend them to wait at least 10 to 15 minutes to let the child self pacify. Let the child pacify themselves at some point. So a parent or mother should be able to differentiate by the end of second or third month of the baby's life If the baby, what is baby's hunger cry, what is the cry to care for them, what is the cry of discomfort. So a mother should be able to differentiate. I'm sure they'll understand by the end of second or third month. So what is a hunger cry? So the importance of p comes here, that it will give confidence to the mother that the baby is receiving enough amount of feed on a daily basis. So these are the basic things that you should keep in mind: targets for weight and importance of p count. I hope I'm clear.
Yes, doctor, that was really, really good.
Yeah.
Yeah, we'll take questions. Parents, please, regarding this topic, put your questions in the chat box. We'll move on to the next topic.
Yes. Yeah. So when to see your pediatrician? Ideally, let us start from your regular visits postnatal, that is after birth. So immediately after delivery or during delivery, you will definitely have a pediatrician who will check your baby for any obvious anomalies that the child might have, or any future events that the child might face. The well-being of the child, weight and everything, height, length and everything, your pediatrician will definitely check and let you know. After that, I would recommend that they get their baby checked at 5 days of age. So for every newborn who is after within 1 week of period, for every newborn, they'll have significant amount of jaundice that they will face, and this is physiological. It means it is normal. Uh, if you get him checked at 5 days, or sometimes some children who have problems with jaundice, which is pathological jaundice, which is not in the physiological range or normal range, will start showing within 3 to 4 days, or on a second day as well. So if you feel that your child looks yellow, eyes look yellow, if his pee looks yellow, then I would recommend you to go to your pediatrician as early as possible, or at least get him checked on fifth day. And if the pediatrician feels that the child has significant amount of jaundice, he'll ask for a blood test to be done. And subsequently, if needed, he'll ask you for a phototherapy or any other therapy which a baby might require depending on the lab values. So after that, in the first month, I would recommend at least two checkups, 15 days and 30 days, to see if the mother is having proper lactation, proper amount of secretion, which will reflect onto the baby's weight gain, urine output, and well-being. So within a month period, a mother should be able to assess if she's getting enough secretion, and if the baby is growing very well or not. So when it comes to a professional, medical professional, so we calculate weight gain on a daily basis as well. So within 1 month period, when it comes to the first 10 days of life, every child will lose, in a worst case scenario, at least 10% of their body weight within 10 days. So for suppose if a baby is born with 3 kilos weight, so it is okay if the baby is 2.7 at 10 days. After that, they'll start picking up. So if we calculate from 10 days at least, so if it is 2.7 at 10 days, and by the time the baby becomes 1 month, so for 20 days, they should at least pick up 20 into 30 gram per day. So 600 grams. So the baby should at least become 3.3 by the end of first month. So this is how we calculate. So I would recommend at least two checkups, one mid-month, that is at after 2 weeks of birth, and the other checkup at 4 weeks of birth. And then from here, you can only get your child checked on a routine vaccination day, which is at 45 days, that is 1.5 month, and 2.5 months, and 3.5 months. So these things would be enough. So when you go for a vaccine for vaccination, get your child checkup. If the baby is doing well, weight wise, and milestones, if the baby is smiling, responding, reciprocating to your emotions, trying to hold things, trying to move onto the bed, trying to roll over bed, trying to sit, all these things a pediatrician will assess. And if he's not doing, please ask him to do a routine checkup of the baby's well-being. So on a regular basis, so you have 1.5, 2.5, 3.5 months, 6 months for flu vaccination, 7 months for flu vaccination, 9 months, at 9 months for MMR and vitamin A, and 1 year for a typhoid vaccine or hepatitis A vaccine. So within 1 year, you at least need 2 checkups in first month, and then 3 vaccine checkups, and then flu checkups. Total becomes 5, 6, 7. At 9th month, 8th checkup. At 1 year, 9th checkup. So I would at least recommend for a well-being checkup at least 9 checkups in 1 year. So you will have a very good understanding of your baby's well-being. Other than this, whenever you feel that the baby is fussy or having a problem, or you feel that the baby has temperature or a fussiness which is more than a day or two, see, there have been recent reports or researches which are telling that the children, the adults who are ending up into depression and anxiety are those people who have never been cared for when they were in infants, who have been crying for days together due to colic pain, that is pain abdomen or ear pain or any discomfort, or who have been not cared enough or not touched enough, not caressed enough. So there are a few researches that are being done in adults who are ending up into depression. See, there's a lot of importance in how you nurture your child within 1 year, although they are not talking to you, although they are highly dependent on you. So all the care and nurturing that you give are definitely having a lot of side effects when they are growing up mentally. So it definitely is imperative on you and compulsory on your part to get them checked at least 9 times. And if they have a discomfort which is lasting for more than 24 hours of time period, and if you think that you're not understanding what the problem the child is facing, or if you're thinking that all the home remedies that you guys are doing are not helping, please get your babies checked as early as possible for anything. I hope I'm clear for
This was
pediatrician visit for at
fantastic.
least
Yeah.
1 year age.
Yeah, and I'm so glad that you broke it down for us.
Yes.
I will compile that so that we can share it with the parents, because a lot of them are unable to take down notes. They're sitting with little ones and hearing you.
Yes.
So I compile it for them. But this was really nice that you've broken it down for us. It makes it much simpler.
Yes.
We'll move on to the next slide,
Yes,
doctor.
please. Yeah. So let's look at feeding as such. So let us start with the traditional breastfeeding. So let us understand one thing. We live in animal kingdom. So we have all kinds of species in the world. So we as human beings are also one species. So every race or every animal is capable of having their own, uh, let's say, newborns. So, and the Lord or God or whatever that you believe in has made sure that that particular newborn will be fed for the first few days on its mother. So technically speaking, if it's a human child, the patient should have human milk. If it's a goat child, it should have milk from a goat. If it's a buffalo child, the child should have milk from a buffalo. So let us just understand this in a broader spectrum. So cow milk and buffalo milk are not for human child. They are for cow child or buffalo child, not for us. So please understand this. Animal milk is not meant for us. If a mother is not secreting any milk, if she's a dry mother, not being able to initiate feeding or some other problem, or the mother has been on some drugs which don't recommend her to feed her child, that's a different scenario of choosing a formula or an animal milk. But in any case, even if the mother has been tested positive for HIV, that is AIDS, or some other disease, there is no contraindication as such for a mother not being able to breastfeed their child. So, no disease, no fever, no flu, no COVID will stop a mother from breastfeeding. There is only one particular reason where you have to stop breastfeeding is if you have abscess in your, which is pus in your breast. So get that abscess cleared and then again start breastfeeding. So the importance of breastfeeding here is you are breastfeeding, for suppose let us say कि a particular mother A has a child B who is so and so weight. Let's say the child is less than 2.5 kilo, which is low birth weight. So what happens in that particular mother is, so that particular mother's body will know that the body has shelled out a baby who is low birth weight. So the body will react in a way that her milk will have nutrients and calories which will try to compensate the low birth weight that the mother has already given to the baby. So this is how our DNA or our chemistry between mother to child has been set up by the Lord. So for suppose if a mother has twins, so just because the mother has twins, it doesn't mean that the mother will have less amount of milk. The God will make sure that the mother will secrete enough amount of milk for both the babies. So that is how the chemistry and biology works between a mother and child. So that is how much unique the relationship is, which is not visible to the naked eye. So this is the first rule of a breast milk. It will try to compensate whatever was not being given in the fetus. The second thing is, so whatever immunity a mother has received over the period of time or since her birth to her childbearing age, all that immunity will be transferred. It's like right click download. It's like that. So it's like just a computer click. So mother is transferring immunity on a daily basis to the child, whatever that she has acquired. See, it's like you having an apprentice at your work. So you have been working for almost 10, 20 years. You have learned so much skill, and your new apprentice has come. And within a day or two, you have just right clicked and downloaded entire into the apprentice's mind. So it's like that big a boon if you are breastfeeding your child really good. And the third important thing is the protein that the breast milk has is custom made or tailor made to your own child for their growth. So not just for immunity, not just for calories, I'm even talking about the protein that the patient will receive. See, the importance of protein here is, if your body needs any new cell, any new hair, any new nail in your body, any new, I'm talking about a cell or a hormone or a chemical to be produced, if there is no protein, there is no work in your body. Basically, it's like if there is no brick, you can't build a home. So if there is no protein, you can't build a body or a cell or anything. So on a daily basis, your body, even to repair, even to form a new thing, it definitely needs some amount of protein, even for chemical messaging, even for enzymatic reactions, even for lipolysis, I mean fat burning, even for anything, any given thing. If there is no protein, your body will not form or make or move or do anything. So the breast milk has that custom tailor made protein that the baby will need. And next, after this, so there is something called cerebrosides. So our brain biologically is made of fat, a different form of fat, which is called cerebroside. So what happens is, so I'm just using the terms which you guys will understand as such, not getting into the technicalities or the biological names. So our brain is usually made up of fat. So a breast milk will have those cerebrosides which a child's brain needs for development and maturity. So this is the importance of breast milk when it comes to the contents that it has. And the other thing is, uh, let us assume that the mother has delivered a child through vagina, which is a normal vaginal birth. So what happens is, when a baby is coming through the vagina, so the baby will the baby comes in contact with all those bacteria which are on the labia, on the vagina, on the surface of the skin. After the baby has come out, we will put the baby on the mother's tummy. The baby will come into the contact of the bacteria that are on the tummy. Later for the breastfeeding, so whatever bacteria are there on the breast, those will come into contact with the baby. So these are the bacteria which are living as commensals in our body, in one's body, let us say mother's body. So these bacteria are not doing any harm to a particular individual. They're only living with us. So it's like a quid pro quo. I'll give you something, you give me something. So these bacteria will give you immunity, you give them food. So our body has immense amount of bacteria in our body. In fact, more bacteria than our body cells. It's called microbiota. So it's like a biological unit between us and bacteria that is there, which is not visible to our naked eyes. So those are, it's like we are commensals to them, they are commensals to us. So technically, if a baby is being born through vagina, the baby, chances of baby getting more amount of bacteria is more, and in the end baby is getting more immunity. If unfortunately, if a lady is ending up having section, so there are a few hospitals in India and a few countries outside who are trying to smear the vaginal secretions into the mouths of the baby as soon as the babies are born through C sections. So I don't know how far it is going to help, but theoretically they are trying to smear the bacteria that were there on the vagina into the baby's mouth, so only to increase the baby's immunity. So the breastfeeding and being in contact with the baby for a very long time, all these things matter a lot. So let's suppose that this particular thing called breastfeeding is not being established in you, or you're not secreting enough, or some problems before the pregnancy, or some medication that you've been receiving, whatever it is. In the end, it turns out that you're not having enough milk. So what to do now? How to choose a formula? So here comes your financial capability. So if you are financially capable, we usually recommend as medical professionals to go ahead with a formula. So what is happening here is, earlier when there were no formulas, definitely every mother would choose an animal milk, be it buffalo, cow, or depending on the country that they live, there are still countries who give camel milk, who feed goat milk also, depending on what animals they have, what domestic animals they rear. So technically speaking, in India we are used to more buffalo milk, and few families go ahead with cow milk. So now that we have good formulas in the market which try to mimic like a breast milk, which try to bring down the amount of casein that they have, which try to mimic the amount of whey protein the mother's milk has, which try to add pre and probiotics into the milk, which will help the bacteria in the gut to make it more healthy. So we generally recommend to have, if the parents are financially viable, we generally suggest them the best formula that is there in the market. And there are varied amounts of formula depending on your price bracket. So they range from 200 rupees per bottle to 1200 to 1300 rupees per bottle as well, per box. So if the patient is not financially viable, we would recommend buffalo first rather than giving a cow milk, because cow milk causes a lot of problems and digestion problems and allergy problems. So if an animal is to be given, we would recommend parents not to dilute it at all. So that is the thing that Indians usually do. They dilute buffalo or cow milk thinking that it might cause a lot of trouble, so hence add more water to it, like equal amounts, which actually doesn't help. So if you add more amount of water, you are only diluting the calories that it has, so it is usually not recommendable, and your child will not have a sufficient amount of weight gain over a period of time like a normal child would have. So if you are ending up feeding your child with animal milk, make sure that it is not diluted. So we usually recommend breast milk until 2 years of age or beyond. So after 6 months, we ask parents to keep milk as a secondary feed and prioritize starting or complementing milk with solids. So by the time a child becomes 1 year old, we usually recommend them that the child should be able to eat from the family pot. That is whatever the parents are eating traditionally. Let us say if the family is a Jain family, and their customs are different, so they have to ensure that by the time the child is 1 year, he should be accustomed to all the Jain habits. Or let us say if the child is a Muslim, so he should be able to, or whatever region that they belong to. The point is not to discriminate between communities here, The point is to have their child acclimatized or habituated to their family habits of how many times they take meals, the habit of what kind of foods that they eat, the habit of what kind of spice that they eat. So the point is to make sure by the time the child is 1 year, or by the time the child cuts his first cake, he should be able to eat whatever the family is having. So due to which what is happening is, so after 1 year the child will start having his own mind, his own choices, his own picks. And if the child is not habituated to his family habits, he'll start being fussy to eating, he'll start being picky towards eating. He'll only latch on to the things which are comfort foods, which is especially milk. And in the end he'll have low weight, he'll be underweight, he'll have immunity problems, he will have iron deficiency, all these things will happen. So if the mother has no breast milk, we generally recommend not to give any milk after 1 year. Just stop all kinds of milk and make sure the baby is having proper traditional 3 meals, 2 snacks, and let the child have fun, let the child explore the world, and not give any kind of milk. So this is what we usually recommend. We have this notion that milk will give some unknown advantage that you think of. The maximum thing that the milk or curd or dairy products can give to your child is some amount of protein, which is usually not digestible in our body, and excessive amount of calcium, due to which your child will end up having constipation. So you'll visit clinics. Most of my constipation, not just mine, most of the all the pediatrician constipated patients are those children who have been on dairy products. And most of the iron deficiency anemia children who come to the clinics are those children who are significantly on dairy product diet. So this is it about breastfeeding and formula and animal milks. I hope I'm clear.
Yes, sir. Doctor, that was really, really, I mean, so much information. Again, I'm telling you, with each slide, I'm learning so much myself. We'll move on to the next slide.
Yes.
Parents, as usual, please, questions regarding milk, formula milk, animal milk, please post them in the chat box.
Yeah, let's talk about newborn skin rashes and when to worry about them. So over the period of 4 weeks, it actually starts within 2 weeks or 2 to 4 weeks. Children will start having a lot of skin rashes, like different types. There are red patches on the body. There are white, pearly, pimple-like rashes on the face, on around the nose, on the body. There is a lot of sebaceous swellings or pustules on the body, which you feel that there are some infected yellow liquid that the baby has. All these things are actually normal. These are all normal variants, and you need not do anything for these. They'll just go away. The only routine that you have to follow are, so see, in the rashes, if the rashes are bullous lesions, so there is something called bullous lesions. So bullous lesions are those lesions or those rashes which are swelled up, and they have water inside, which you can make out the swelling is filled with water. So those are infective lesions. With these lesions, if the baby's activity is dull, if the baby has fever and high temperature, you have to rush to a hospital. For any other rash, you can actually wait, and they will go away over 2 to 4 weeks of time period from the baby is born. So you don't have to worry about them. The only routine that you have to follow is apply moisturizer twice daily minimum, and make sure you give good bath, at least with water, to your baby, of water from body temperature, and clean your baby's hair, or give them a good head bath. These are the basic things that you need to do, and don't use any food products on face. Like, there are people who use besan ka atta on face. There are people who use ghee into ears or face, or maska onto the body. So, or any sort of oils which are used in cooking. So what happens is, these things have uh, so these are food items, these are organic items. So the tendency of bacteria brooding on these items increase more. So if you use things which are organic onto the body, you are only attracting more amount of bacteria, and your child will end up having fungal infections or bacterial infections. So we usually recommend not to use any organic product onto the body, and use a non-fragrant, scent-free chemicals or soaps or moisturizers onto the body. So this is the thing about skin rashes. I hope I'm clear.
Yes, doctor. Next
Yes.
slide, please.
Yeah, when to bathe the newborn and massage, and how long should you massage? So the thing is, when to bathe is if the baby's birth is really good, if birth weight. So if the baby's birth weight is about 2 kilo, let's say 2.5 kilo, and if you're confident enough, you can go ahead with bathing the baby on that particular day. So you can see, ideally give bath at least once a day. So there are a few parents who would like to give twice daily, which is usually not necessary. If you at least follow the routine of giving one bath a day, then that is enough. So like the image in the picture that you see, so there's a clear cut bathtub or a sink type of thing for a baby to bath. See, the you can see that the child in the image looks happy. So if you bathe your baby in this position, every baby will be happy and will play. So it's like take a tub, make the baby sit or use your both the hands. One person should hold the baby around the chest and back. The other person, so the particular water in the bathtub contains foam. So add lather into the water already, and make sure the person who is holding is not trying to bathe. The other person is just using the foam and rubbing off the baby's body. So this way, it will have two advantages. One, the baby will stop crying, will start enjoying the bath. The second point about this type of bathing is there won't be any water going into the nose or mouth, which will create noisy breathing later, which the parents might think the patient has cold. So technically, for 6 months to 1 year, no child will get any cold or cough. It is either due to noisy breathing that the parents will feel that the patient has cold or their baby has cold, and it is due to the improper burping or reflex or spitting that the child will have, due to which the baby will have cough. So these are the main reasons which need not be treated. If you bathe your child in a tub like this, sitting them upright, you will have less amount of issues with noisy breathing and cough. And how long should you massage? See, massaging, there is no such thing that massaging will give good muscle or any such thing. Massaging is only to give you more time to spend with the baby, caress the baby, feel the baby, touch the baby, and the baby will have a feeling, emotional feeling that the baby is being cared for, being touched, being emotionally loved, and the baby's brain will become stress free, and the baby's brain starts producing chemicals which will make the baby feel good, and the baby will end up having good growth, good mental growth and physical growth. So this is the main point of having a particular routine called massage. So what you can do is you can put the baby on a massage before shower, and after that give the baby a shower, half an hour of massage, 10-15 minutes wait for bathing, and then bathe the baby and apply moisturizer and just leave. So if the baby is having a frequent amounts of infantile colic, if you massage around the tummy, it might help. You're just making sure that whatever gas is left is coming out by just massaging the baby's tummy. So even that kind of massage will help. And there is one particular thing about massage that I want to tell. So I think it's an age old thing that our oldest used to follow, putting oil into nose and ears, which is to be avoided, like completely avoid. Don't do it at all. It's like a red flag if you're doing it. The other important thing is massaging the nipples, and the nipples are swollen. There are a few people, especially old timers, who try to press them and squeeze out the milk that it will produce. Never do it. That's a red flag again. Never massage the nipples of a baby. Never press if they are already swollen. If the nipple is swollen, try to apply ice over it if it is painful. If it is not painful, just leave it. It will become normal over the time. It is due to the hormones the mother has and the mother imparted into the baby. Few babies will have swollen up nipples and few babies will have milk in it. So never massage, never press, never do anything on a nipple if it is swollen. So I'm sure I'm clear. I hope I'm clear about bathing and
Yes,
techniques.
doctor. Absolutely. We'll move on to the last slide, after which
Yes.
we'll be going on to the question and answer. Sorry, the time has, I know it is extended, but you were explaining it so beautifully that I didn't want to cut you short anywhere. Yeah, this is the last slide. We'll be taking question answers after this.
Yes, yes. So I'm sure everyone knows about stem cells by this time. People who have ended up having pregnancies and having kids, I'm sure every hospital must have told them about storing their stem cells. Earlier, like a decade back, there wasn't much research to stem cells. So now the research and the treatment modalities that are being employed due to stem cells, the scope has increased so much that they are being used in deformities, they are being used to treat ulcers, they are being used to treat bone problems, they are being used to treat hair fall, they are being used to treat for so many things. So it's like if you see now, people who haven't stored their stem cells are actually buying the stem cells that they match from market. So let's say that you are storing your own stem cells when your baby, when you give birth. So those stem cells will help you, your baby, and your other children as well. It's like you are storing. It's like you are saving up your own money for your own kids. So stem cells are like, if you don't store them in the future, if for suppose if you need some money for your kids' education, and if you have not stored it, you will definitely take it from bank, you will buy it from a bank. So let's say you have actually stored your own stem cells, it's like your own money for your own kids purpose. So definitely earlier, probably 10 years down the line, 15 years down the line, there wasn't much recommendation of stem cells because there wasn't much scope or much study into how they can be useful. But now that we know how to use them, we know how to when to treat, how to treat, and how to isolate them, and how can it be and helpful. I'm sure there are a lot of benefits with stem cells that are going, that are been happening. And I'm sure we will reach to a point where even to create organs, I'm sure we'll end up creating organs from placental stem cells for sure. So the future is definitely bright with stem cells. So if you are financially capable, I would recommend everyone to at least have their placental stem cells stored. And you've already been in touch with this company called ReeLab. I'm sure they'll help you with placental stem cells, and I'm sure they're very good at it. I hope you will understand the importance. It's like having your own cell bank for your own body's purposes. It's like consider them as a currency.
Thank you, doctor. Thank you so much. We'll
You're welcome.
quickly move on to the Q&A now. So I'll just read out the questions, doctor, and you can quickly answer them.
Done.
So the first question is from Pallavi Srivastav.
Yes.
So doctor, does it mean we should only take DPT vaccine pain-free and the rest, the usual ones, are better for immunization?
No, 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 absolutely not. I would actually recommend every patient of mine to go ahead with the painful vaccine that the government gives because it is for free. And the only thing is, in the first dose, it will have slightly discomfort. It will have a very slight discomfort which the patients have to bear for a couple of days, and then it will be okay. So fever is good, is what I keep telling. But if the patients are well enough and if they don't want the children to suffer, they can go ahead with a pain-free vaccine. It is up to them.
Noted.
Yeah.
The HIB 3 dose needs to be taken because my pediatrician said now it's being eliminated as per AAP. That's Dipali's question.
Yes, yes. So the thing is, there are a few vaccines which are being given in an extra dose because the companies are manufacturing them in a way that they are being included with the other vaccine. So HIB comes in, if it's a government vaccine, it comes included in Pentavac.
Oh,
So a patient will receive 2 doses of Pentavac in 1 year and 1 dose in 18 months. Not 18 months. Yeah, we can say that The patient will have 3 doses in the first year, 1 dose in the 18 months. So until the companies start removing them, you just can't follow AAP guidelines. So AAP will only make guidelines.
Correct.
Manufacturing will happen from the company's side.
Correct.
So if the pharmaceutical companies are providing us vaccines which have no HIB in it, we would definitely recommend, because it will help with the costing thing.
Mhm.
So right now, whatever are being given in the market, you can actually go ahead with it. So when the companies come up with a vaccine which has one less dose of HIB, so you can definitely go ahead with it and definitely have cost effects on you.
Right.
Yeah.
Shweta wants to know, my baby has at least 7 to 8 wet diapers in a day, which could easily be 20 pee counts, and poops after every feed. Is this normal?
Yeah, this is absolutely normal. You just have to see babies on breastfeeding, especially, can easily pass up to 15 to 20 poops every day, and can easily pass 10 15 times of urine every day. But considering this fact, you should also check if the baby is gaining weight really well, and if the baby is having good enough sleep. If the baby is on top feeds or formula, you have to check if you are over diluting the feed, which in case the patient will have more amounts of peas and you'll have less amount of weight gain. So you will have to check the weight gain. You'll also have to check the amount of sleep and the milestones the patient is receiving. If a patient has, if your baby has these many, I'm sorry, I got used to referring everyone as a patient. So yeah, so if your baby is having 7 to 8 wet diapers or 20 poops or pees in a day, make sure and check the baby's weight, make sure and check the baby's sleep pattern. If these things are healthy, you don't have to worry. If these are not healthy, so there is some issue with the feeding that you're giving.
Right. This is a very common question that gets asked. Doctor, my child is having constant cold cough. Anything we can do to minimize? How do we know when it's serious and we need to meet a doctor?
Yeah. So the most common visits that we keep getting within 6 months, or let's say within 1 year, is cough, cold, cough, cold, cough, cold. So within 6 months of age, I wouldn't recommend anyone any drugs to be given for cold that the parents feel that their baby has. So it is just the noisy breathing that they have. One thing is improper bathing. The patients will end up having water into nose or mouth. The second is improper burping. If you're not giving enough burps to the child, chances are that the child will burp and the milk will flow into the nose and the patients will start having noisy breaths. And after 3 months or 4 months of age, children will start keeping everything into the mouths, especially their fingers and hands. They'll end up having gag reflex kind of a thing, and they'll start coughing. So this is also normal. You don't have to give anything. So within 6 months of age, if you feel that the patient has cold, just instill nasal saline drops into the nostrils. That's it. Nothing to be needed, and you don't have to worry. If you feel that the patient is
Yeah.
having rapid breathing, a refusal to feed, that is when you have to go visit a doctor.
I think she also, in context to children, I mean, up to 2 years of age or whatever,
Yes, yes. So
then
more than
how
six
do we
months,
deal
if
with
you
it?
feel that your child is ending up having frequent colds or coughs associated with wheeze that you can hear in your audible to your ear, or if you feel that the child has rapid breathing, I'm sure the child will definitely have some kind of atopy, which is allergic portion or capability of having atopy in his body. It can be due to familial problems or genetic issues or lack of a proper breastfeeding. If it is more than 6 months and within 2 years of frequent episodes, you should get your child evaluated for having atopy, which is kind of an allergy if you talk in common words.
Right.
Yes.
Okay. We'll move on to the next questions.
Oh,
Shweta,
yes.
sometimes she feeds for 10 minutes, sometimes 30 to 40, sometimes, but sleeps for 2 hours after. How do I understand when she's full and has taken enough?
Yeah, it is all subjective basically. It depends on babies to baby. So the amount of time period to be spent, it is definitely on baby to baby. Sometimes what happens is, if the baby is full and if the baby feels that the baby doesn't require anything, they'll just stop feeding. If the baby needs more amount, they'll keep taking more and more for a very longer period. So for suppose if, yeah, there are a few mothers who are not like sufficiently secreting, or who are not giving good enough time. So let us get the basics of feeding first. So what happens is, when you are feeding, the milk that your breast has will flow in two sections. The first section is called fore milk, and the second section is called hind milk. So if you are feeding your baby for a very less period of time, so the baby is only receiving fore milk. The hind milk is being left behind. So it turns out that the fore milk only has water in it. It will only quench the thirst of a baby. Hind milk will have fatty content in it, which will give satiety to the child, which will cater to the hunger of the child. So if you are feeding for a very less amount of time, chances are that the child's thirst is being quenched, and the child will wake up immediately within a while to have milk again. So if you are spending less amount of time every time, so you're just giving water to the baby, and in the end you'll feel that the baby is not gaining weight, waking up again and again, being crying every time. So you will have a very unhealthy time, and the child will end up having less amount of weight. So by the time the child becomes 2 months, the mother will understand how long to be fed, what is the right amount of milk that the baby is receiving. So in this particular context, what I recommend is, make sure you feed on one particular breast, and make sure that the breast is empty over a couple of feeds, and then shift to the next heavy breast. So it's the healthy practice of giving the entire amount of fore milk and hind milk to the child on one particular breast, completing it, and getting onto the next breast for the next number of feeds. So if you ask me, time amount of feed the patient baby requires to feed, it is subjective, depends on baby to baby. A mother should be able to understand over a period of time.
Thank you, doctor, for answering
Yes.
both the questions. Her weight gain has been fine. I went to the pediatrician. She's 20 days old. Her weight gain has been good.
Good.
So I should not be worrying then, right?
Definitely, yeah. You don't have to worry. Just spend more time with your baby, feel good, caress your baby, and enjoy the parenthood.
Absolutely. Thank you.
Yes.
Thank you, doctor. We'll move on to the next one. Should mothers avoid dairy products while breastfeeding?
Not at all. If mothers love dairy products, please have. I personally recommend mothers should have whatever they feel that they should have. The ultimate goal is them being happy. If they are happy, they'll have good hormones, they'll secrete good milk, and their babies will be happy. So if they are eating whatever they want to eat, they'll end up being happy. So whatever, even if it is junk, if they want to eat, let them have once in a while. If it makes them happy, let them have.
The restrictions of pregnancy about avoiding shellfish and certain cheeses and all of that, does that still stay when you're breastfeeding, or?
I don't think so. There is no such study, or there is no such recommendation we have ever come across. So the main thing that we usually tell parents is to have diet which has good protein in it.
Correct.
It will help with good secretion.
Makes sense.
Yeah.
My daughter, Pallavi Srivastav, my daughter is 30 days old now. She has been vomiting a lot, 6 to 7 times a day, very cranky. She's been asked to switch from Aptomil Gold to Lolac since I am lactose intolerant, to low lactose formula. Is she getting enough nutrition with it?
Spitting up and being cranky can be due to reflux, and lactose intolerance will have different set of symptoms. So it will have exploratory diarrhea with rashes around anus, and inadequate weight gain, and frequent cranky for sure. So the thing that you are experiencing with Aptamil Gold that you're feeding right now, with excessive spitting and being cranky, I think you can cut it down by bringing down the quantity of milk that you're feeding in each time, and making it more frequent. and keeping the upper part of the baby's tummy free, so that whatever is being come up will not be spat out, and it will cause less vomiting and less crankiness in the baby for few days until the baby adjusts. So I basically avoid parents to give any low lactose formulas, because lactose in the first year is considered to be a smart nutrient. It helps your brain to grow really well. So if you don't have symptoms of exploratory diarrhea, I wouldn't recommend you to shift to low lag. But if you think that low lag is helping with vomitings, please use it for few days and get back to your Aptamil Gold as
And
early
her
as possible.
second question on the same topic is, she takes 60 ml at a time. Is that enough?
Yeah, 30 days 60 ml is like, I'm sure she's almost 2.5 to 3 kilo by now. If she's taking 60 ml and if she's more than 3 kilos, I think she's taking less to her weight.
Okay.
Yeah.
Bhavika wants to know, is it normal for a child of 2.5 years to have night terrors, where they wake up crying and blabbering? How do I manage it so that her sleep doesn't get disturbed? Currently, I have to wake her up to get her out of it.
Night terrors are definitely common, but not so common that it is happening often to Bhavika's child. I'm sure there is immense amount of stress or some issues happening in the family or outside the play area or in the play school, that whatever Bhavika is sending to or not, she should tell. So if the baby is having it on a daily basis and it is definitely hurting her sleep, the patient definitely needs some therapy or intervention or drugs to have a good sleep. So there is a drug called melatonin. It will help with having a good sleep hygiene. I would recommend Bhavika to have her child checked. I would recommend also to her to get an EEG done.
Okay.
Okay.
We'll move on to the next question. Riddhi Kothari. I
Yeah.
was told for my first child not to bathe him for 5 to 6 days, as the biofilm, white creamy stuff on their skin at birth that they are covered in, is good and protects their skin.
Yeah. So the thing is, the white cover that the babies come out when they are born with the white cover that they have, it's called vernix caseosa. So vernix basically. So it doesn't take 5 to 6 days for the vernix to get absorbed into the body. It only takes 5 to 6 hours. So within 6 hours, the entire vernix that is the white covering that the baby comes out with will actually get absorbed into the body. So this particular white cover is only to give warmth to the body for the first initial 5 to 6 hours, so that the baby will acclimatize to the ambient temperature. There is no such thing that you can't wash this film away. Over a period of time, it will go away. And if you have a good warm and ambient room, you can actually bathe the baby as early as you want to.
Right.
Yeah.
We'll take the last question now, doctor.
Yes.
My daughter is 6 months and 20 days old.
Okay.
Yesterday she had 4 loose stools with some cough-like thing. Was it because of teething? I think by cough-like thing, she may be referring to mucus in the pores.
Mucoid.
Yeah.
Yeah, mucoid stools are actually normal. So we consider mucoid stools or green stools to be hunger stools, or maybe we call it empty stomach stools. It is actually normal. You don't have to worry.
Okay. Yeah. I think we are done with the question. This was quite a marathon session, doctor. I
Yeah.
think by far the most elaborate one we've ever had.
Yeah.
Thank you so very much. Dr. Wasim is available for WhatsApp consultations. I shall be sending you his details. I would like to thank him so very much for the time and the amount of information he's given all of us.
Thank
Um,
you.
I would like to thank Seema from Sama Birthing for this opportunity. Over to you, Seema.
Thank you. Thank you, doctor. Really very nice of you. It was nice to hear your views and so patiently you explained each topic. I really appreciate it. Thank you.
Thank
Really
you. Thank
kind
you.
of
You're
you
welcome. Thank you.
for being here on a Sunday morning. And
Thank
thank you all of you all to be here joining. I hope you all benefited.
Yeah.
I'm
Great.
sure you did. Thank you so much. We can only
Thank you, Saloni. Thank you
thank
so much.
you.
Take
Happy
care.
Sunday, everyone. Yeah, happy Sunday. Thank you. Bye bye.